I'm Sara Lang. I have ulcerative colitis, which is a form of IBD, and I'm a volunteer with the Alberta IBD Consortium. I have ulcerative colitis, and to me it's a journey, and it's something that I've been managing and that I'll have for the rest of my life. It was really shocking to find out that I had IBD, and the way it happened was, I think it's sort of a classic story of, I started to get symptoms and they're gross, and I was denying them and wasn't doing anything about it until it got to the point where I had been a short track speed skater and on the World Cup and national team and world championship team for years and years. It was just a normal season for me until I started getting these weird symptoms that I was ignoring. And I was supposed to be on my way to go to the World Cup trials for our first set of World Cups. And instead of going to the World Cup trials, I wound up in the ICU at Foothills. And that's where I was diagnosed with having inflammatory bowel disease. This is when, I started to get really, really scared about the unknown. And this is when, I had to use all of my skills, my mental training from skating to kind of work through that. But what was really lucky for me is I met Remo Panettino, who's now my doctor. And he was so supportive, and he knew how to work in my medication and how to manage my disease, given that I was a world-class athlete.
I'm Remo Panettino. I'm the director of the Inflammatory Bowel Disease Clinic and associate professor of medicine at the University of Calgary, and a member of the Alberta Inflammatory Bowel Disease Consortium. IBD is inflammatory bowel disease, and it encompasses two main disorders, Crohn's disease and ulcerative colitis. And they're chronic inflammatory disorders of the intestine. They're somewhat different. Crohn's disease can affect you from your gums to your bum, so all parts of the intestine, whereas ulcerative colitis just affects the lower part of the intestine or the large intestine. And patients can have a variety of symptoms. Most of it has to do with diarrhea, sometimes unfortunately with blood, abdominal pain and cramps. And because it affects people when they're young, it actually impairs quality of life from a young age. Because the symptoms tend to be chronic, and because the course of the disease is up and down, there's a lot of uncertainty with it. So during a time of a flare, when patients are not controlled, the symptoms cause them to miss school, miss work. It can have impact on their family members, especially their children and their spouses, because these patients really don't want to do anything. What I say is, feel it when you have the stomach flu or a gastroenteritis. Think about how you feel then and stretch that over long periods of time, and some people are chronically active, never well again. The most important thing is that we have as many patients recruited into the study as possible, and there's really two types of patients. There's the patients who've had inflammatory bowel disease for a long period of time, and they provide one level of information. So the more that they can sort of know about this project, get involved at the university level, give us the information, then that's very, very important. The other patient is the patient who's just been diagnosed, because they're different. They're not exposed to the medication. In their course, we can follow the natural history over a long period of time. So what I would say to Calgarians and to Albertans in general is, if you have inflammatory bowel disease, please speak to your physician about the possibility of enrolling in this important study. And certainly, we hope that not only will it help the individual patients, but because of the genetic nature of the disease, many of these patients, other family members, their children, their sisters, their brothers may develop Crohn's disease, and certainly this will give us a big step forward in trying to identify A, what causes the disease, and B, even get new therapeutics to these patients so that we can improve their quality of life.
I'm Herman Baka. I'm team leader of the Alberta IBD Consortium, and I'm professor in epidemiology of infectious disease at the Faculty of Veterinary Medicine and the Faculty of Medicine at the University of Calgary. The overall goal that we have is to improve the health and the quality of life of Albertans with inflammatory bowel disease. A lot of people in Alberta, 15,000, suffer from it, and it really deters the quality of life that they have. And we want first to prevent it, and secondly also to cure it in these people. What we find out about the genes in people We can also look for it in cattle or in dogs, but also the other way around. And the same in the interaction between those genes and bacteria that we find in the intestines. The mechanisms most likely will be similar in animals as in human beings. So we want the veterinary researchers and the medical researchers to talk with each other and brainstorm and interact to solve these problems.
I'm Dr. Dillivan. I am a gastroenterologist here in Edmonton. I'm an associate professor of medicine here at the University of Alberta. Things we find on clinical research, such as what are the genetic factors between patients that have IBD and don't have IBD, or what are the environmental factors, such as, for instance, like air or water pollution, or diet, or and exposure to certain contaminants in the past, or you can actually also have microbiology factors, like what kind of bacteria do you have in your gut that you get a disease in association with your genetic factor versus people that do not have it. So those are kind of factors that are going to be studied in the so-called clinical research, because we need patients for that.
I think the power of bringing all the experts in the IBD consortium together is that, to me, it's I kind of relate it to skating. On our team, we had a lot of different skaters that had a lot of different strengths, and everyone would play to their strengths. So you'd have skaters that were quick, you'd have skaters that had great endurance, they were strong, you had skaters that were great at passing, skaters that were great at keeping other people from passing them. And when we'd have the relay event, we'd all come together and play to our strengths. And that's what led to our success. And to me, this is the same thing, where you have people that are experts and they have strengths in so many different areas. You have veterinarians, you have doctors, you have researchers, and they're all coming together and playing to their strengths. And it's a really innovative approach, because it allows them to explore outside the box, and I think that this approach is gonna lead to something really great.